Hi YouTube. So I'm making a really quick video on my cell phone, and it's mainly because I'm really not feeling that great. I ended up going to the emergency room because I was having a lot of lower abdominal pain, and I actually thought that it was a bladder infection. It ended up being a really large cyst on my ovary, so I'm not really feeling that great, so I just wanted to make a quick video on here to be able to do my week 17 update. I was told I have to go and check with an OB/GYN to kind of see where to go from here. At first, when I went in, I thought it was a bladder infection, and then they said it wasn't, and so then I did a CT scan because they thought maybe it was my appendix because it was on like the middle and the right side of my stomach, and they found out that it wasn't my appendix, but that's when they found out about the really large cyst on my ovary. So it's kind of scary, kind of overwhelming. Like the doctor told me, people get these, women get these all the time. So I'm trying not to stress and to worry, but of course you have all these things go through your mind. Will you ever be able to have kids? Will you, just like all these different things. So it's been a very, kind of stressful day. But as for this week, week 17, last week I weighed 306, and this week I weigh 302.4 pounds. So I've lost 3.6 pounds, which is awesome. I'll take that. Only 2.4 pounds away from the 200s. So I'm almost there. I hope next week I can report to you that I'm 299.9 or less. Let's see. This past week has been kind of another very emotional week for me. In therapy, we're doing EMDR. It's either EMDR or EDMR. I think it's EMDR. Because I have a lot of past issues that I'm trying to work through to be able to help me with my overeating problem. And, when you've spent all your life kind of shoving down the food and not really feel the feelings, when you actually feel them, they're very, powerful and very overwhelming, really. And so it, emotionally tires you out. And, it's just very emotional. So, like I say, my week's been, it's been an okay week, weight-wise, but just, emotion-wise, it's been definitely hard. Definitely keeping up with the water aerobics. I really enjoy that. That's the one thing that I can kind of do and keep up with and not necessarily dread because I love swimming. I have a couple times, rode the exercise bike and done the treadmill at the YMCA, but I'm really trying to stay with the water because that's what I enjoy. Let's see. I actually went to a plus-size store called Catherine's. I'm not sure if they're everywhere in the U.S. I know you can order off a line, but I'm not sure if, wherever you live, if they have them, but they were having, this clearance sale, and so I got a bunch of clearance items. I figure once I feel better, I'll do, a Catherine's haul, so you can kind of see what I got. I kind of got a lot of stuff. I've thought about returning some of it because I know that I'm going through clothes so quickly that I really don't want to buy that much. Granted, if you think about 7 days a week, really I got, an okay amount. I'm definitely not going to buy any more until I lose even more weight. And what I did is, I got a couple of pairs of jeans in my current size, and then I got a pair for the next size down. So I kind of thought that was a smart idea. So yeah, once I'm feeling better, I'll probably do a haul on that if anybody's interested. And I actually went and saw my surgeon. I was supposed to have, this Friday I'll be 4 months. And so you're supposed to have like your 3-month checkup. Well, I had to reschedule with him, and because his schedule was so full that I was just able to see him this past week, and so it was like more than a 3-month checkup. But he was really excited about my weight loss. He was really happy. And one other thing I should do is I should probably do like a full body shot, because most of my weight is in my stomach. And because of that, even before I had surgery, I had a lot of like my lower stomach really hung. And he was telling me that, as you lose weight, it's going to hang even more. And so he's wanting us to document it so that my insurance will hopefully pay for that surgery to remove the loose skin, and that it won't be considered a cosmetic procedure, which I'm happy about, but it also really sucks because I've heard that plastic surgery hurts really bad. Because, you have, like, for your stomach, like a tummy tuck or something, like, they have to cut it all the way across. That's a big, like, cut. But I know in the end I will feel better, I will look better, because he was telling me, like, that alone will probably be, like, 5 to 15 pounds, depending on, how much loose skin there is. So, we'll have to see. Hopefully with the documentations, like, we took pictures, and he told me that every time I come, we're going to take pictures, and, we're also going to give those pictures to my general doctor so that hopefully they can also report to the insurance that it's something that will be medically necessary. But I am really glad that my surgeon is excited with how much weight I've lost, because I've been kind of worried about that. Like, am I losing fast enough? Am I doing the right stuff? And he just totally confirmed with me that I'm doing a great job. I wish I had remembered, though, to tell him about my worries about stretching my stomach. But I didn't. I was so excited that he was happy that I totally forgot to ask him about that. But I need to just what I keep telling myself is, okay, you're trying your best. You're doing everything you possibly can. And so you're doing okay. So that's what I really tell myself. And let's see. I guess something that's been affecting me lately also, besides like being emotional with all of the stuff going on in therapy, is I feel like I'm redefining who I am. Like, I'm redefining who I am without food. And so I think it's also you're redefining relationships in your life, like with friends, with loved ones, and it's easy to feel lost, and not necessarily lost that you don't know who you are, like you don't know if you're a nice person or if you're funny, but you feel lost in that your food isn't your best friend anymore, even though sometimes you feel like it still is. So you're trying to figure out who you are without food defining you and your emotions. So it's really, like I've said before, a day-to-day thing. I've been feeling this the last couple of weeks, so I just thought I would mention it. I think I mentioned it in my last video. I know it's nothing that's going to happen overnight. So just trying to work through it the best I can. I wanted to kind of go over some non-scale victories I've had lately. One big one is I don't have to wear seatbelt extensions anymore. Now, in some cars, I never had to, but there were some vehicles that I did, and it was so embarrassing. I no longer have to do that, and that makes me feel so good because you're not worried about what other people are thinking. in a way you kind of feel a little normal, you know, because you don't need that extra stuff to be safe. Of course, on the biggest one over the last several weeks, like clothes are getting looser. And then, of course, clothes that were tight before are starting to fit right or be loose. And so you're seeing yourself lose more inches, which is really exciting. Let's see. And I think the biggest thing for me, you know, and I've mentioned this before, is my stamina. Like, I live like 2 blocks away from my YMCA. I can walk there, I can exercise, I can walk back. Like, before surgery, yeah, that would never happen. I would be exhausted. And not to say that I'm not tired after working out, because I am, but I'm still able to walk home and not be like dying. Before, I would have been dying, like seriously, like I would have just been like, okay, I'm not doing this again. Because my back would be hurting and my feet and just everything. So the stamina and just being able to do more. I feel like every week I'm doing a little more than I did last week. And it's kind of amazing because it kind of shows me how before surgery, how little I actually was able to do. And it really makes me never want to go back to there. I think I'm always going to have a food addiction. I think it's always going to be something I have to conquer and overcome. But I think just remembering all the small things, well, they're not necessarily small, just remembering all the things like the stamina and things like that will help me to not go back there again. So that's about it for this week. I hope to be feeling better soon to make some videos, because I want to make several videos this week. It's just the pain's been so bad that I've been like really overwhelmingly nauseous, and like at the hospital they had to give me some Zofran to help with the nausea, and they actually gave me pain medicine and sent me home with pain medicine. It's actually been pretty bad. Like I've been pretty miserable. So yeah, I definitely hope to be able to make some videos, but we'll see. If not, I will definitely do them next week. And I hope everybody is having a great week, and I will talk to you soon. Bye.